Did you know that 1 out of every 10 Americans suffers from diabetes? Diabetes is called the royal disease because it will be your companion until death. Let's talk about type 2 diabetes today. Type 2 diabetes is a lifelong disease that keeps your body from using insulin the way it should. People with type 2 diabetes are said to have insulin resistance. People who are middle-aged or older are most likely to get this kind of diabetes. It used to be called adult-onset diabetes. But type 2 diabetes also affects kids and teens, mainly because of childhood obesity. Type 2 is the most common type of diabetes. There are about 29 million people in the US with type 2. Another 84 million have prediabetes, meaning their blood sugar is high but not high enough to be diabetes yet. Signs and symptoms of type 2 diabetes often develop slowly. In fact, you could be living with type 2 diabetes for years and not know it. When signs and symptoms are present, they may include increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, slow healing sores, frequent infections, numbness or tingling in the hands or feet, areas of darkened skin, usually in the armpits and neck. Factors that may increase your risk of type 2 diabetes include being overweight or obese is the main risk. Fat distribution, storing fat mainly in your abdomen, rather than your hips and thighs, indicates a greater risk. Your risk of type 2 diabetes rises if you're a man with a waist circumference above 40 inches or a woman with a measurement above 35 inches. The less active you are, the greater your risk. Physical activity helps control your weight, uses up glucose as energy, and makes your cells more sensitive to insulin. The risk of type 2 diabetes increases if your parent or sibling has type 2 diabetes. Although it's unclear why, people of certain races and ethnicities, including Black, Hispanic, Native American and Asian people and Pacific Islanders, are more likely to develop type 2 diabetes than white people are. Increased risk is associated with low levels of high-density lipoprotein cholesterol, the good cholesterol, and high levels of triglycerides. The risk of type 2 diabetes increases as you get older, especially after age 45. Prediabetes. Prediabetes is a condition in which your blood sugar level is higher than normal, but not high enough to be classified as diabetes. Left untreated, prediabetes often progresses to type 2 diabetes. Your risk of developing type 2 diabetes increases if you developed gestational diabetes when you were pregnant, or if you gave birth to a baby weighing more than 9 pounds. Having polycystic ovary syndrome, a common condition characterized by irregular menstrual periods, excess hair growth, and obesity, increases the risk of diabetes. Areas of darkened skin, usually in the armpits and neck. This condition often indicates insulin resistance. Healthy lifestyle choices can help prevent type 2 diabetes, and that's true even if you have biological relatives living with diabetes. If you've received a diagnosis of prediabetes, lifestyle changes may slow or stop the progression to diabetes. A healthy lifestyle includes: choose foods lower in fat and calories and higher in fiber. Focus on fruits, vegetables, and whole grains. Aim for 150 or more minutes a week of moderate to vigorous aerobic activity, such as a brisk walk, bicycling, running, or swimming. Losing a modest amount of weight and keeping it off can delay the progression from prediabetes to type 2 diabetes. If you have prediabetes, losing 7% to 10% of your body weight can reduce the risk of diabetes. Sitting still for long periods can increase your risk of type 2 diabetes. Try to get up every 30 minutes and move around for at least a few minutes. For people with prediabetes, metformin, an oral diabetes medication, may be prescribed to reduce the risk of type 2 diabetes. This is usually prescribed for older adults who are obese and unable to lower blood sugar levels with lifestyle changes. How horrible diabetics look depends on your healthy and active lifestyle. If you have diabetes, tell us in the comment box below how to control it. Keep an eye on our next video to find out what foods you need to eat to control your diabetes. So guys, we are leaving today. If you enjoyed this video, please like, share, and subscribe.